Darlings, Dr. Lucy here from Real Life Medicine with another episode of Keto in the Car, except I'm never in the car anymore, but the title's stuck. This week we're talking heart health. So yesterday was World Heart Day, and I had a big chat yesterday. So today's going to be a slightly smaller chat. No need to bang on forever and ever. But today I am going to talk about a super common condition, hypertension or high blood pressure. So when I went through medical school, quite a long time ago, morning Bern, how are you, darling? The causes of hypertension were basically essential, which meant we had no idea what it was, and then rare things, adrenal tumors, little blockages in renal arteries, all of those sorts of things. But these days, hypertension has become more and more prevalent. Now, it is a problem because hypertension leads to heart disease. As we mentioned yesterday, it's one of the biggest causes of heart disease. So what we want to do is minimize hypertension, so have beautiful, optimal blood pressure control. And the standard way of doing that is medications. Now, there are sometimes people need medications, okay? I'm not anti-medication. But the thing is, there are lots of things you can do to improve your blood pressure without medication. Now, we've all been taught, and we are diligent in a low salt diet. Here's something, right? This is a little flip on that old salt paradigm. And I know that a lot of you know this now, but I'm going to say it again. We know that actually glucose is much more of a problem than actual salt. So what I mean by that is that in our kidney, we have a thing called the sodium glucose transport mechanism. So glucose and sodium go together. So when you go on a low carbohydrate diet or lifestyle, because not a diet implies short term. I mean, in the traditional thinking of what a diet is. I use diet much more generically, as in, I have a whole food diet, I have a low carb diet, that sort of thing. But when you reduce glucose in your body wheezes out salt. Now, for heaps of people with high blood pressure, that reduces their blood pressure instantly. Well, not instantly, like not that day, but in the first few weeks. It's amazing. So I am frequently reducing blood pressure medications, getting rid of blood pressure medications before big weight losses occurred, simply by changing what you eat. Now, for people who don't have high blood pressure, I'm often recommending lots of salt, because they've weeded it all out and they'll get really dizzy and fall over. Their blood pressure gets a bit low. Transitioning, sometimes people even with high blood pressure need some salt just to help with that electrolyte balance, but over time they can reduce it if they want to. But honestly, my favourite thing, mine and Mary's, is to reduce and de-prescribe medications. If we can manage health with lifestyle changes, it's an absolute bonus for lots of people. But the main person is you. It does. If you can manage these conditions without medications, then you're saving money. No need for a script every month for the rest of your life. You are reducing side effects. Okay. All medications, no matter what, have side effects. And you're reducing the risk of drug interactions or medication interactions. Polypharmacy, which is a fancy name for lots of medications, is a huge problem as in our elderly population. As we get older, people are having more and more medications. And the thing that's also happening, how's this for sneaky? And it's wrapped up in the idea of it's convenient, is there are medications that are 2 in 1. So 2 tablets in 1 pill. Or 2 medications in 1 pill. So you can be on like maybe 2 pills, but you could be on 3 medications or 4. And there's talk of, super pills where you can have 3 or 4 medications in one tablet. Now, I know that's good for convenience, just one pill, but honestly, it's that same thing. What about all the interactions? What about, tailoring it specifically to the person? So a lot of the time, I will have people that are on a blood pressure tablet that's actually a 2-in-1. It'll be something called an ACE inhibitor or A2 medication, and then a diuretic. And so the first thing I do is get rid of the diuretic. So they're still on one pill. And for some people, they go, I'm still on a tablet, but you're actually on less medication. So you know what? We all know the less medication you're on for your life, the better. Now, the caveat being, if you don't do the lifestyle recommendations, then you need to take the medication. You can't have it both. I have some people who go, I don't want to take the tablet, but I'm also not doing the lifestyle change, in which case that's a disaster. You're just at high risk. So peeps, this is our jam. We love doing lifestyle modification to not just prevent, but treat disease. It's absolutely king or queen. I'll leave you with that thought. Bye, my loves.